Hello, 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 YouTube world. It's Miss Patty with For Your CNA, and we are here for our live CNA practice test game show. So excited to see you guys. Hi. How is everybody? I know I'm a little bit late. I apologize. My computer had to update, and it took a little longer than I anticipated. So sorry about that, guys. All right. Can you guys hear me? If you can hear me, give me a thumbs up in the chat or let me know in the chat and we will get started. Good morning, guys. Looks like we have quite a few people here already. Hi. I know you guys were all waiting on me. Sorry. Oh, I know. I hate the updates and they come at the most inconvenient time. Absolutely. All right, guys. Okay, so good. We're ready to go. So let's give me 1 second here. I got a new setup. I got to figure out where I'm at. All right. So if you're new and you don't know how this works, we look at a specific segment of what's going to be on the what they call the test plan and provide 15 questions according to that category. So you can kind of see the types of questions you would see or the way they're going to be written or the content. So it kind of gives you a good overview of what to expect on the state exam. And while you're answering these questions, you're competing for prizes as well. We'll get to the prizes in just a moment. So happy, Guillermo. Thank you that our videos have been helping. Yeah, Julie, I'm here. I hope that you can see me. Okay, so today's topic actually came from one of our OGs, our Blue Jedi. She gave me a suggestion that we have one that kind of focuses on home health because that's really her domain. And CNAs can work in home health. So I thought, yeah, I haven't really focused on home health, and I'm actually creating the curriculum for a home health program right now. So this all kind of goes together. So today we're going to focus on some questions, CNA questions that might be on the state exam because as a CNA, you are allowed to work in home health as well. So it's not just hospitals or nursing homes or those types of acute care settings or long-term care settings. CNAs also work in home care. You're not going to have a lot of questions about home care on the state exam. You might have one or two. The thing to remember here is that all the same principles apply. So everything we learn to do as a CNA in any other setting, the foundations of those lessons are still going to apply here. So, and we'll get into that a little bit more when we get into the questions. So there's not a whole lot of specific to home health questions, but I wrote the questions in a way that will kind of highlight the home health aspect. So I hope that helps. Okay, guys, I'm so sorry. My dogs are going crazy. So if you hear them, just kind of bear with us today. So most of the questions, even though they're going to be home health related, most of our questions are going to come from this category, basic nursing care provided by the nurse aide. And the basic nursing care really focuses a lot on recognizing emergencies. Now, this is a little bit different than section 3. So this is section 3. This is what most of you guys think nursing care is, right? Feeding, bathing, dressing, grooming, those types of tasks. Those actually aren't nursing tasks. Those are ADLs. Now, ADLs are activities of daily living. These are things you do for yourself every day. Everybody does, just to maintain a good, healthy lifestyle. So these actually aren't nursing specific topics. They're things that we think are nursing because it's what we're doing on somebody else. But they're actually not. And a lot of your questions today are going to come from this category as well, because patients in home care tend to be very stable. And this is the type of stuff that we're helping them with. If they can't shower by themselves anymore, we'll help them with that. If they can't feed themselves or prepare simple meals, we're going to help them with that. So home care really is going to focus on this. But when it comes to the test, right, these are universal. It doesn't matter what setting you're in. If you're going to bathe somebody, you get water, you check the water, you make sure it's warm, and you ask the patient to check it too. That is, doesn't matter what setting you're in, those rules apply. The reason that I'm saying that the questions today are going to come more from section 4 is because this is really what's important in the home care setting. When you're working in home care, sure, you're going to help people with bathing, feeding, grooming, dressing, all of those daily tasks, but your patients in a home care setting are pretty routine. What we're really concerned about, I mean, you can kind of handle all that by yourself, and you don't need a team, you don't need the office. You can go in, learn what you need to do, and do it. Your patients don't change. But the problem is that when you're in a home care setting, you're not around other caregivers. You're alone in this setting. And knowing what to do in an emergency in that situation is super important, because if you have an emergency in any other setting where there's a team of people, if you drop the ball, somebody else is probably going to pick it up, right? If you're standing there going, oh my gosh, this patient's choking, I don't know what to do, somebody else will probably swoop in there and take care of the problem, because it's a team effort. But in home care, there is no team. There's nobody that's going to swoop in and help you out if you run into a problem. So we have to know emergency processes really, really well when it comes to home care, and adhere to the principles that we're learning on how to do these skills, so that we're not allowing problems to occur, allowing emergencies to happen. So that's what some of these questions are going to focus on. So just so you kind of understand, the questions are really going to apply to any setting, but in home care, understanding emergencies is way more important because you don't have a team. All right. Yeah, you just can't. Yeah, you're right, Blue. You just can't run and grab a nurse if something comes up. You've got to know how to react. Okay. Um, I'm sorry, Nicole. I apologize. Nicole, try to go out and come back in. And a lot of times that fixes those types of issues. All right. So let's get into our prizes. So you are competing for real prizes. First place prize is a T-shirt. Now I'm actually wearing our class T-shirt today. It has the where is it? For Your CNA logo here, and on the back, I'm not going to turn around for you, but on the back, you can see it there on the screen. It has our big block letter, says For Your CNA, and inside each one of those letters is everything that I teach. We call it a cheat shirt, because it has all of the principles right there for you, as well as some testing tips. So this shirt becomes an all-in-one cheat sheet for the test. Don't wear it to the test, but if you get it and read it, it will give you everything that you need to remember to take the test successfully. So this is one of the shirts you can get. You can also get Become Inspire Care. That's one of my favorites. Called to Care, which is our pink heart shirt, and CNA Care Crew. So if you come in first place, you'll get a T-shirt, and you can tell me which one of these you want to get. Second place is our card game. And that's here. This is the CNA Principles card game. It's a lot of fun to play. It's kind of like a rummy style game where you're collecting sets of cards. And the sets are the principles that we teach. But along the way, you've got to avoid the crappy caregivers. You don't want to do HIPAA violations or call off crises or documentation errors. Those specialty cards will really derail you. So there's a lot of strategy to it. It's a lot of fun. You don't have to be medical to play it, but if you are medical, it's going to help you study. So it's a great study tool, as well as having the ability to play it outside of medical as well. And then third place, sorry guys, I didn't have this ready. Third place are motivational gifts. You get the badge holder. Now, I don't give these out. Nobody can get these outside of winning them. Other than my instructors, our partner instructors, I do try to give them out occasionally at different events. And then we have some motivational gifts as well. So those are the prizes that you are competing for. So how do we play? Well, I'm going to display a question on the screen. I'll read it to you along with the answer choices, and you're going to have in total 60 seconds from the time it displays. You're going to have some time to decide what the right answer is and put it into the chat. Now, when you put it into the chat, don't use words. Use numbers. The number 1, 2, 3, or 4. Okay, just use numbers. Put the number in and hit send. Don't put anything else. It will only read the numbers, okay? So be really careful there. Don't put other words in there, just the numbers. The fastest right answer gets the most points. So the fastest right answer gets the most points. This is going to be judged based on the order that YouTube receives the input. So it may show a little different on your screen than what YouTube is receiving it. I don't have any control over that. It's based entirely on how far from the servers you are and how quick your internet connection is. So remember that the program is king. Okay, so I go by the program. So I hope that kind of helps you understand how this works. Prizes are only sent out to the United States. I do not send prizes out internationally at this time. I'm just not set up for that. All right, so if you are ready, get your fingers limbered up. We're going to get started in 30 seconds. So we're going to have 15 test-like questions. And today's topics are going to focus on CNAs working in the home care arena. Good morning, Helen. All right, so we're getting ready here. 10 seconds. I'm going to read the question and the answer choices. Put your answers in the chat. 1, 2, 3, or 4. Here we go. What is one of the most important responsibilities of a CNA working in home health? 1, assisting the client with activities of daily living. 2, administering medications. 3, diagnosing medical conditions. Or 4, providing financial planning advice. So what is the most important responsibility of a CNA working in home health? Yeah, I'm starting you off super easy, guys. This is super easy. You guys should know this. You know your role here. So what are CNAs going to do in home health? Know your role. All right, go ahead and lock in your final answer. You've got about 10 seconds left. 10 seconds left. Okay, the right answer here, yeah, you guys all got this one right. It's assisting client with activities of daily living, ADLs. That's what we do. CNAs do not administer medications without additional training. Now, some states will let CNAs help patients with medications as long as they receive additional training based on the requirements of the state. CNAs don't diagnose, not our job, not even remotely our job. And we do not provide financial planning advice. Now, this one can get you into trouble because a lot of times your patients are going to ask you sensitive questions just because they're looking for guidance. Do not fall into that trap. Don't answer them. Don't answer those types of questions. We assist with daily living. Know your role. So Medina came in first, followed by Josh, Carter's, and B1N. Good job, guys. All right, question number 2. Which document outlines the specific care a client should receive? 1, insurance form. 2, medication label. 3, care plan. Or 4, HIPAA notice. So which document outlines the specific care that a client should receive? 1, their insurance form. 2, medication label. 3, care plan. Or 4, HIPAA notice. Go ahead and lock in your final answer. You've got about 20 seconds left. I know these first couple are pretty easy. And for the test, you are going to have a few easy questions. You will. And then you're going to have some that aren't quite so easy. All right, the right answer here, and all of you guys should have gotten this one if you've listened to me at all, it's all about the care plan. Absolutely. And even in home care, you're going to get a care plan. Unless you're working private. If you and the client are working together without any agency involvement, if it's a private duty case, there won't be a care plan. And understand that that could put you at risk because CNAs follow the care plan. Without a care plan to follow, you're actually directing the care, and that means that you are totally liable for all the decisions you're making. That's not optimal. Working for an agency is a much better option because now you have a care plan to follow and somebody to report changes to. All right, very good. B1N came in first, followed by Tanny, Josh, and Medina. Good job, guys. Question number 3. When should gloves be worn during home care? 1. Only when feeding the client. 2. During any contact with blood or body fluids. 3. When giving a back massage. Or 4. At all times. So when should gloves be worn during home care? 1. Only when feeding the client. 2. During any contact with blood or body fluids. 3. When giving a back massage. Or 4. At all times. Go ahead and lock in your final answer. Yeah, this one got a little harder, didn't it? The first two were easy, and this one's a little bit harder. All right, let's see what the right answer here is. 5 seconds left. Here we go. The right answer is number 2, during any contact with blood and body fluids, because in home care, the same rules apply. So if we're going to touch body fluids, personal skin, like things normally covered by a bathing suit, or non-intact skin, you need gloves on. But you aren't going to wear gloves for everything, all the time, at all times. First of all, it's not practical. But secondly, when you wear gloves without thinking about it, you stop thinking about it. And that's when we actually accidentally cross-contaminate. So wearing gloves at all times is not the right answer. You do want to wear gloves if you're going to be contacting body fluids, personal skin, or non-intact skin. B1N came in first, followed by Josh, Tanny, and Micheline. All right, number 4. If there is a fire in a home care setting, the CNA should first, 1. Call 911. 2. Call the office. 3. Close all windows and doors. Or 4. Evacuate the patient. So if there's a fire in a home care setting, the CNA should first, 1. Call 911. 2. Call the office. 3. Close all windows and doors. Or 4. Evacuate the patient. What do we want to do here? So we've got about 20 seconds left. Yeah, this got a little harder, didn't it? Remember, those emergency processes are super important to know how to react to because we don't have a team in place. Very good. So 5 seconds left. Go ahead and lock in those final answers. The right answer here is evacuate the patient. Always. Patients and fire should never be in the same place, ever. And I know some of you put number 1 first. Let's talk about that. On the test, you're going to have questions that are written like this, where the first answer looks like it's probably the right one, right? Fire, call 911. That's what we're trained to do. But I caution you not to jump on the first answer. Read all of them to see if there's a better answer. And in this case, there was. Evacuate the patient is what we're going to do before we call 911. And you will want to call the office. Closing all windows and doors, that helps starve the fire a little bit, but that's not our first priority here. Josh came in first on that one, followed by Tanny, Carter's, and Russ. Okay. Question number 5. What is the most important action before helping a client with bathing? 1. Check water temperature. 2. Turn on the fan. 3. Close all the windows. Or 4. Move the laundry. What is the most important action before helping a client with bathing? 1. Check the water temperature. 2. Turn on the fan. 3. Close all the windows. Or 4. Move the laundry. Go ahead and lock in your final answer. Nope, B1N, I've got you in here. I see you. All right, 15 seconds left. Go ahead and lock in your final answer. What do we want to do before helping a client with bathing? If you've listened to me at all, you know this one. We just talked about this in class yesterday. All right, the right answer here is number 1. Check the water temperature, because what feels comfortable to you may not be comfortable to the patient. Everybody has different preferences. And as we age, we lose that layer of fat between our skin and our nerves, and temperature is going to be felt much, much differently without that insulating layer. So it's very, very important that we check the water temperature, make sure it's warm, and the patient has an opportunity to check the water temperature and let us know if it needs to be adjusted for comfort. Now, during the intro, I actually gave you the answer to that one if you were paying attention. Okay, let's see how we did. First place is Tanny, followed by Kirsten, Peterson, and Josh. Good job. Question number 6. What is the best way to prevent the spread of infection? 1. Wearing sandals. 2. Using lotion. 3. Opening windows. Or 4. Hand washing. What is the best way to prevent the spread of infection? 1. Wearing sandals. 2. Using lotion. 3. Opening windows. Or 4. Hand washing. Go ahead and lock in your final answer. You've got about 25 seconds. This seems like a really silly question, doesn't it? On the state exam, you may have 1 or 2 questions that have a really strange answer, and you're like, what is that? What does that have to do with anything? Wait a minute, is that important? I didn't learn about that. Don't be surprised. Some of the questions will have answers like that, and they're designed to throw you. Hand washing is, of course, the best way to prevent the spread of infection. Wearing sandals has nothing to do with this. Nothing. But it probably got you thinking, well, wait a minute, I didn't hear anything about in my class about wearing sandals. What does that have to do with anything? And it's designed to trip you up. Remember that you have to focus on what you know. And you know, or you should know, that hand washing is the number 1 way to prevent the spread of infection. That's why we're going to wash our hands before we touch the patient. We do our opening, knock, knock, knock. Hi, Miss Jones. How are you today? I'm here. I'm Patty, your CNA today, and I'm here to whatever. Is that okay? Close curtain, wash hands. Don't touch that patient until your hands are clean, because that's the best way to prevent the spread of infection. Josh came in first, followed by B1, Tanny, and Medina. All right, 7. What does HIPAA protect? 1, the aide's job schedule. 2, grocery lists. 3, utility bills. Or 4, a client's private health information. So what does HIPAA protect? 1, the nurse aide's job schedule. 2, grocery lists. 3, utility bills. Or 4, a client's private health information. Go ahead and lock in your final answer. You've got about 25 seconds left. What do you think? What do you think? Yeah, this is a pretty easy one, but I want to talk to you about this one once we reveal the answer. There's something about here that you do need to know, other than the obvious. All right, what does HIPAA protect? HIPAA protects the client's private health information, anything that's identifiable. their name, their address, their phone number, their diagnosis, their social security number, right? Anything that would allow somebody that's not related to the medical care of the patient to have information that they don't have. But I do want to talk to you about some of these other things, though, particularly utility bills or bills in general, and grocery shopping for patients, because these are things that we often do in a home care setting, help the patients with paying bills or doing their grocery shopping. That information should also be kept private. Anything relating to that patient, if you're paying their electric bill, you don't need to go tell your family how much the patient's electric bill was. So Josh came in first, followed by B1N, Sydney, and Tanny. Question number 8, halfway point. How should a CNA assist with a client's medication reminders? 1. Remind the client to take medications on time. 2. Open all pill bottles. 3. Decide if medications are needed. Or 4. Give extra pills if the client is in pain. So how should a CNA assist with clients' medication reminders? 1. Remind the client to take medications on time. 2. Open all pill bottles. 3. Decide if medications are needed. Or 4. Give extra pills if the client is in pain. What do you guys think? 10 seconds left. Go ahead and lock in your final answer. Yeah, you guys all got this one. This is an easy question. CNAs can remind patients to take their medications on a schedule. CNAs do not open pill bottles. That's not something that we do. We don't decide if medications are needed. There should be no judgment here. You don't suggest a medication. All we can do is remind the patient to take their regularly scheduled medications. And we do not ever give extra medication ever. That's not something that a CNA can do. And it's very important because the chance of overdose is very, very high, especially if there's nobody else overseeing the medication schedule. So be very, very careful there. You can remind the patient to take their regularly scheduled medications. That is the extent of your role in medications as a CNA. Number 9. What is the correct way to lift a heavy object in a client's home? Number 1, bend at the waist. Number 2, bend at the knees and keep the back straight. 3, keep legs straight and pull the object. Or 4, twist and lift quickly. So what do you think? What is the correct way to lift a heavy object in a client's home? 1, bend at the waist. 2, bend at the knees and keep the back straight. 3, keep the legs straight and pull the object. Or 4, twist and lift quickly. What do you guys think? Go ahead and lock in your final answer. 10 seconds left. You probably will have a body mechanics question on the state exam. The right answer here is always bend at the knees and keep your back straight. You do not want to lift with your back. You want to lift with the bigger muscles of your thighs and legs. So we bend at the knees. So you squat down to lift up. Very, very important. Do not bend at the waist and do not twist. You do not ever want to twist when you're holding something heavy because the discs in between your vertebrae are fragile and they're prone to injury with twisting. So be very, very careful. Don't ever do number 4, ever. Keeping your legs straight and pull, that isn't going to help. It's just not going to help. Bending at the waist will actually put you at risk. So bending at the knees and keeping your legs straight is the right answer here. Josh came in first, followed by Medina, Carters, and Kirsten. Good job. Good job. Question number 10. When should you report changes in a client's condition? 1, at the end of the shift. 2, only if the client asks. 3, immediately. Or 4, after calling the family. So when should you report changes in a client's condition? 1, at the end of the shift. 2, only if the client asks. 3, immediately. Or 4, after calling the family. So when do we want to report changes? I'll give you a hint. This doesn't have anything to do with home care. When do you want to report changes? About 10 seconds left. Go ahead and lock in your final answer. 4 more to go after this. Almost done. The right answer here is immediately. All changes are always reported immediately. Don't wait here, guys. If you're reporting changes at the end of the shift, it doesn't really give the supervisor time to address those changes. And what if the patient is deteriorating? What if the changes that you're seeing are indicating a much bigger issue that requires a nurse's assessment? We don't know. So changes do not get stored up and reported all at once. Changes should be reported immediately, no matter what setting you're in. I hope that helps, guys. Okay. Kirsten came in first, followed by Elanza, Josh, and Tanny. Question number 11. What is a sign of elder abuse? 1, increased appetite. 2, clean clothing. 3, watching television all day. Or 4, unexplained bruises or burns. So what is a sign of elder abuse? 1, increased appetite. 2, clean clothing. 3, watching television all day. Or 4, unexplained bruises or burns. Go ahead and lock in your final answer. You've got about 20 seconds left. We're going to talk a little bit about this question. So what is a sign of elder abuse? Go ahead and lock in your final answer. The right answer here is number 4, unexplained bruises or burns. But let's talk about number 1 for a second. Generally speaking, patients that are being abused, and family members can certainly abuse elder patients, but so can caregivers. So we have to watch our patients for signs of abuse, and generally it's not an increased appetite, it's a decrease in appetite. It's not going to be clean clothing. Wearing dirty, rumpled clothing can be a sign that the patient's being neglected. Watching television all day, there's no problem there. But understand that you are probably going to be the first person to notice changes in a resident that would indicate that they're being abused. Yeah, it's way more common than you think. It's very sad. Tanny came in first, followed by Josh, Kirsten, and Medina. Anything that you see must be reported. Question 12. How often should you reposition a bed-bound client? 1, at least every 2 hours. 2, once a day. 3, every 5 hours. Or 4, when they ask. How often should you reposition a bed-bound client? 1, at least every 2 hours. 2, once a day. 3, every 5 hours. Or 4, when they ask. Now this is something I'm actually going to be going over in my classroom live stream. I believe tomorrow I'll be covering this. So if you don't know the answer to this, tune in to tomorrow's live stream. Go ahead and lock in your final answer. You've got about 10 seconds left. The right answer here is at least every 2 hours. Care plan might even say more often than that, but the baseline is at least every 2 hours. This is going to help promote circulation. maintain skin integrity and prevent pressure sores, but it also helps with gastric motility, which is the ability of food to move through the digestive system. It helps with being able to expand the lungs and breathe deeper. It helps with restoring blood flow to the brain, and it can help minimize muscle atrophy, which is the shrinking of muscle due to non-use. So turning and repositioning a patient often is very, very important for a lot of different body systems. Ilzana came in first, followed by Kirsten, Medina, and Tanny. Good job, guys. Question 13. What should you do if the client refuses care? 1. Force the care for their own good. 2. Leave immediately. 3. Respect their decision and report to the supervisor. Or 4. Call 911. What should you do if the client refuses care? 1. Force the care for their own good. 2. Leave immediately. 3. Respect their decision and report to the supervisor. Or 4. Call 911. All right. Go ahead and lock in your final answer. I'm going to give you guys a little hint or a clue. Any answer that starts with the word force or make or prevent is probably not the right answer, because that's not our role. Yeah, we're not going to force anything, even though we know that's why you're there, right? You're there to provide care. If the patient says no, no means no. So forcing care on a patient is not the right move. That's not our goal here. Leaving immediately, that if the patient refuses care, you leaving does not help the patient. It's not providing any higher level of care. Respecting their decision and reporting it to the supervisor, that's the right move here. Patients have the right to say no, and they can say no to anything at any time for any reason, but the supervisor needs to know that they are refusing care. And please do not call 911 for this. Tanny came in first, followed by Medina, Josh, and Kirsten. All right, question number 14. What is the proper method to dispose of soiled linens? 1. Throw them in the trash. 2. Put them on the floor. 3. Rinse them in the kitchen sink. Or 4. Place them in a plastic bag away from clean linens. So what is the proper method to dispose of soiled linens? 1. Throw them in the trash. 2. Put them on the floor. 3. Rinse them in the kitchen sink. Or 4. Place them in a plastic bag away from clean linens. Got about 20 seconds left. Go ahead and lock in your final answer. Yeah, this one seems pretty easy. And if you watch my live stream, my classroom live stream yesterday, we actually talked about this in quite a bit of detail. So go ahead and lock in your final answer. Hopefully my classroom students are getting this one right. All right, the right answer here is to put them in a plastic bag away from clean linens. Do not put soiled linens on the floor. Even though you might be comfortable doing that in your own home, you take the sheets off the bed, you put them on the floor until you make the bed, and then you take them into the hamper or the laundry room or wherever you're going to take them. We dry off with towels, and a lot of times we'll throw that on the floor. We'll take our dirty clothes off and put them on the floor. These are things that aren't really triggering anything in your brain because they're normal for you. But you in your home setting is completely different than a patient in their setting. We don't put dirty items on the floor. You don't throw items away. If they're soiled, we wash them, and we don't rinse them in the kitchen sink. It's not very hygienic. So Alonza came in first, followed by Medina, Vanessa, and Tanny. Last question. Here we go. Why is good nutrition important for elderly clients? 1, it prevents boredom. 2, it helps maintain health and prevent illness. 3, it helps them watch TV longer. Or 4, it reduces medication costs. Why is good nutrition important for elderly clients? 1, it prevents boredom. 2, it helps maintain health and prevent illness. 3, it helps them watch TV longer. Or 4, it reduces medication costs. Go ahead and lock in your final answer. You've got about 20 seconds left. Oh, I'm glad you made it to a live class as well. All right. 10 seconds. Final question. Go ahead and lock in your answers. And we'll see how we did. Right answer here. It helps maintain health and prevent illness. Sure, absolutely. Good nutrition is essential for every single age group. Good nutrition, though, can actually help improve energy levels so they don't watch TV longer. They might feel a little more energized to take a walk or get involved in an activity or play cards or put a puzzle together or some other diversionary activity that's a little more interactive than just sitting in front of a TV. So good nutrition can help with cognitive function as well as physical function. It's just a really good all-over strategy to maintain your patient's health. So yeah, it can prevent boredom and it can help distract from that mindless TV watching. Tiani came in first, followed by Josh, Alonza, and Vanessa. Good job, guys. Good job. So, total scores. Oh, Josh just barely eked out Tanny for first place. So, Josh is first, Tanny, Medina, and Kirsten, followed by Alonza. Good job, guys. Awesome job today. So I hope that helped you a little bit understand the types of questions that you might see on the state exam. And I think Josh won last time too. He won a prize. I'm not sure. So a lot of the questions that you're going to get on the state exam are going to be kind of easy, like some of these were. They were no-brainers. You didn't have to think hard about them. The question came right to you. Some questions are going to be a little more challenging. They may have answers there that make you think, I'm not sure. And remember that some questions are going to be written in a way that it's going to try to derail you, and the first answer might look like the right answer. Make sure you're reading through all of those answer choices to make sure you're choosing the best right answer. So I hope that helped. So let's take a look at the prizes here again. First place, Josh knows best, is going to get a t-shirt. So you get to choose from the Become Inspire Care, Called to Care, CNA Care Crew, or the cheat shirt, or the class shirt is what we call it. So you can decide which shirt you want and let us know. The way you're going to do that, let me get into the chat here. Hold on. Guys, if you could see this is like Mission Central here. I got 3 screens going, so I've got everything running so I can put display all this for you. All right, so here we go. First, second, and third place winners. You need to send me an email to foryourcna@gmail.com. And first place, you're going to tell me which t-shirt you want, your size of t-shirt. They're all going to be on black shirts. Which t-shirt you want and the size of t-shirt. Second place, you'll get the card game. Third place, you'll get the motivational gift. So when you email me at foryourcna@gmail.com, when you send that email, you need to tell me your screen name, your real name, your mailing address, and then what place you came in. And Josh knows best is going to also tell us which t-shirt you want. So I hope that this helped you guys. I hope that you kind of have a little better idea of what to expect on the state exam. I hope you had some fun too. I sure have fun hanging out with you guys on our game show. We do this on the first and third Tuesday of every month at 11 a.m. The next one won't be until October, so make sure you tune in for that one. And I look forward to seeing you on our next game show. Congratulations to all the winners. You did fantastic. And thank you guys for participating. Everybody that showed up. We truly appreciate you and your support. If you like this, give me a thumbs up on YouTube. That tells YouTube that this content was informational or entertaining for you. So make sure you give me a thumbs up on YouTube, and that helps with being able to generate more content for you. All right, guys, I'm going to go ahead and wrap up for today. And thank you guys so much. Oh, thank you. Thanks for tuning in. And if you've got a suggestion for an upcoming game show, please make sure you let us know. Drop us a line at foryourcna@gmail.com. And we would be happy to take your suggestions under consideration. And who knows, you might actually be the reason for the next game show. So let us know. Awesome, Tanny. Tanny received the book in the mail yesterday. Awesome. Miriam, you're very welcome. All right, guys. And if you found any of these a challenge, by the way, I keep forgetting to tell you this. If you found any of these a challenge, go download my ebook. The ebook is at foryourcna.com/ebook. Yep, just go to foryourcna.com/ebook, download the ebook. It's free. And it helps you identify what the question is actually asking and how to eliminate certain choices. Oh, hey, Helen. That's okay. All right, until next time, guys, I'm going to go ahead and sign off. Until next time, happy caregiving. Bye.